Okay, so good afternoon again, and thank you for your patience. We're running a little bit late, and we'll get going as we welcome our fourth panelist. So, okay. So welcome to this very important session. My name is Kojo Loko. I am the Executive Director of the Challenge Initiative based out of the William H. Gates Institute at Johns Hopkins Bloomberg School of Public Health. I also serve as a senior faculty member at the school and also Deputy Director of the Gates Institute. And to welcome to this session, which is a philanthropy in a new era, transforming family planning for the future. We gather at a pivotal time for global health and development across the world. The architecture of family planning is evolving, shaped by demographic change, economic uncertainty, technological innovation, and the growing insistence that local voices and youth leadership must drive the future. In this shifting landscape, philanthropy's role is both indispensable and complex. It must navigate political fragility, widening inequities, and competing global priorities, all while ensuring that women and girls everywhere can access the information and services they deserve. Today's discussion explores how major philanthropic actors are rethinking their strategies to move from funding projects to strengthening systems, from driving innovation to sharing power, and from global solutions to locally led transformation. Together, we'll unpack three big questions. How are philanthropic priorities and models shifting to reflect new realities in family planning? What innovative and equitable approaches are emerging that truly center local leadership and sustainability? And how can collaborative philanthropy across foundations, governments, and the private sector accelerate progress towards universal access? I am joined here by an exceptional panel of leaders whose organizations have each shaped the global reproductive health agenda in powerful ways. And I will be introducing each of our panelists. Allow me to start from, well, just my immediate left. Just a minute. So we have with us from the Global Financing Facility, that's GFF, is Supriya Madhavan. Supriya is the lead for reproductive, maternal and newborn child and adolescent health and nutrition plus gender team at the Global Financing Facility Secretariat in DC. After having spent 4 years in the office of MNCH at USAID, she joined the Africa region of the World Bank as a demographer and senior health specialist in 2007, and formally joined GFF as of 2023. Over her career, she has worked in South Asia and Sub-Saharan Africa in the areas of family planning and MNCH and humanitarian assistance. Join me in welcoming Supriya. Sitting next to Supriya is from SIF, Miles Kempley. Miles Kempley represents one of the most dynamic philanthropic actors in investing in youth and reproductive health. Miles is the Executive Director of the Sexual and Reproductive Health and Rights at the Children's Investment Fund Foundation, SIF. Miles has led SIF's adolescent sexual and reproductive health work since 2016 and has been with the foundation since 2012. Before joining SIF, he spent over a decade working across Africa and Asia with organizations such as Marie Stopes International, where he led programs in Madagascar and supported the expansion of family planning and cervical cancer services across Sub-Saharan Africa and Pakistan. Earlier in his career, Miles worked with the Carter Center and Médecins Sans Frontières in Sudan and Liberia, managing programs tackling neglected tropical diseases and humanitarian health crises. He holds an MSc in Public Health from the London School of Hygiene and Tropical Medicine. Let's welcome Miles. And sitting next to Miles is Aparajita from the Gates Foundation. And Aparajita brings 2 decades of experience at the foundation, where she has led major initiatives across health, nutrition, and development. From overseeing the Uttar Pradesh portfolio in India to leading donor partnerships with governments and institutions across Europe and Asia, Aparajita also plays a pivotal role played a pivotal role in the AVHAN, the Foundation's landmark HIV prevention program in India, guiding its successful transition to government ownership. Before joining the foundation, she worked with McKinsey and Company in New York, serving media, retail, and telecommunications clients, and the Walt Disney Company Corporate Strategy Planning Group in California. She holds an MBA from the Harvard Business School and an AB in government from Harvard University. Please join me in welcoming Aparajita to the panel. The last and not the least, we will welcome Emma from the Inter-American Development Bank. Emma Ibriate is the Executive Secretary of the Salud Mesoamerica Initiative and the Regional Malaria Elimination Initiative. The Salud Mesoamerica Initiative was awarded the IDB's Innovative Team Award in 2015 and received a prestigious P3 award from Concordia, sponsored by US Department of State and the University of Virginia in 2021. Emma holds a degree from the Universidad Nacional Autónoma de Honduras. My Spanish is not too bad. She earned a master's in public health from the Tulane University in New Orleans and is an alumna of the executive education program at Harvard Kennedy School of Government. Welcome, Emma. And as you can see, we have here a phenomenal group of people to discuss this topic in terms of the new era of philanthropy. And I think you will learn from this that we will be looking at philanthropy and the strategies that some of the organizations here represented are tracking, but also we'll look at the nexus of where philanthropy meets development finance. So my first question will go to you, Aparajita. So the Gates Foundation has been at the forefront of funding family planning for decades. What has changed most in your philanthropic strategy over the past few years, and what is driving that shift?
Well, I mean, I think the world has changed, and so we are trying to adapt to it. I think that's the top line. The approach to near-term impact that we've taken, which is to try to see, while we build sustainable platforms for financing and delivery, what can we also achieve in the next 5 years while we have time until the SDGs 2030? How do we bring together different actors, ideally across different fields, and try and accelerate impact, but measure it very, very specifically, and hold ourselves accountable in the end for voluntary access to contraception by women, which then translates into the ability to track things like MCPR. So I think the focus is more on proving the impact, showing the impact, demonstrating the impact, while building some systems, not necessarily only health systems, but frankly funding systems, fund flow systems, partnership systems, and advocacy systems. And so I think I would say it's a two-pronged approach to what is a very, very difficult environment of massively shrinking resources. So I would say our tact has been to increase focus and try and prove the impact as quickly as possible, accelerate the impact.
Thank you, Aparajita, and thanks for throwing light on that. And part of this conversation will be more or less unpacking and kind of giving you a sneak preview into the mindset of the philanthropy organizations. And often, I mean, if at conferences even like this, philanthropists and donors really are sometimes like an enigma around, and sometimes we cannot always figure out how it is that they're approaching. So I do hope that as you hear these responses, you also frame your questions, such as some of the things that are going through your head in terms of where philanthropy is going to, where development finance is going to. You can ask some questions. So thank you, Aparajita. I'd like to move on to Miles. And Miles, you're the only male amongst them, yeah. So SIF has been at one of the largest private sectors, has been one of the largest private investors in family planning with a reputation for innovation and scale. In this evolving philanthropic landscape, how is SIF rethinking its strategy to remain bold, catalytic, and responsive to country priorities, particularly in Africa and Asia?
Sorry, that's jet lag for you. Look, it's a real pleasure to be here. I'm very grateful to have this opportunity to speak with you. Kojo has said some really lovely things about the foundation I work for, but I'm actually quite curious to know what you think. So I was wondering if you could put your hands up if you're familiar with a program that SIF funds in sexual and reproductive health. And I have bright lights in my eyes, so I can't see faces, but I can see hands. So can you keep your hands up if you think that program was particularly innovative and creative? Fewer hands. And can you keep your hands up if it was clear to you how SIF makes its decisions on what we fund? Far fewer hands. Okay, so this is why we're here, right? So this is an opportunity for me to share a little bit about what the foundation does. But I'm going to actually be cruel and point out my colleagues in the audience. Actually, SIF staff, please stand up if you're in the audience, because we are here because we want to learn. We've got things to share, but we want to learn and we want to hear from you. So Linda, David, Malcolm, and myself, we're here. So come find us, hunt us down, and if you've got questions about how the foundation works, please take advantage of this wonderful moment. Thanks everyone. So look, for those that don't know us, I'll share that the foundation, we are the world's largest foundation that is committed to the lives of children. Each year, we are dispersing almost $700 million, and sexual and reproductive health and rights is a massive priority for us. We are working towards dispersing $200 million per year. And I mean, we're a children's foundation, and so it absolutely stands to reason that we believe family planning, reproductive health, and rights are absolutely fundamental for the lives of children, for young people, and future generations. So our board, our executive team, my colleagues, we're 100% committed to it. In the sexual and reproductive health team, we've got 22 people that work at SIF. They come from 16 nationalities. They cut across public health, manufacturing and private sector programming, advocacy, and creative financing solutions. And to answer, I mean, we all know, we are faced with a situation which we know there is a collapse in traditional sources of financing. Our value add as philanthropy needs to be even more clear under these circumstances. And our legitimacy as a funder is quite rightly questioned. We are not accountable to taxpayers. We are accountable to our board and to the decisions of wealthy individuals. We recognize that. At the same time, that there is enormous pressure to localize decision-making, empower individuals and at local level. I would also say that philanthropy should also be doing a lot more in sexual and reproductive health and rights. And we consider it a personal responsibility of the foundation to be making the case actively, purposefully to other foundations. And it's one of the reasons why we join hands so often with our wonderful colleagues at the Gates Foundation. How much time do I have, Kojo? 3 more minutes. Okay, so I'll take for 3 minutes. So I'll split it up. So I'd like to share 1 minute on given these circumstances, what's staying the same. 1 minute on what is stopping, and one of the things, and then finally on what we're going to do more of. So what stays the same is we are, despite these changing circumstances, we remain completely committed to comprehensive SRHR across family planning, safe abortion care, sexually transmitted infections, HIV prevention, SGBV. These are fundamental to how our portfolio works. And we will stay committed to investing across the value chain. So that means we will do both upstream investments, work to strengthen health systems, advocacy and civil society strengthening, and downstream delivery. We are also committed to continuing to create more integrated platforms using stronger platform partnerships. Like the same individuals that need sexual and reproductive health and rights are the same individuals that are deeply affected by the consequences of climate change or have urgent need for interventions in nutrition. We retain our passion for working with young people, and our founder is one of the world's most successful businessmen, and he is an absolute inspiration to us all. He's also the hardest person I've ever had to work for, but we will continue to apply best business practices in what we do. What is stopping? So we are purposefully moving away from project funding. We'll still do proof of concept, we'll still do testing and research, but we'll tie these things to where we have very clear pathways to scale. We are also no longer going to be funding service delivery programs where these don't align with national strategies that have clear ownership by national stakeholders. And with deep regret, as many of you know, we also have restrictions on who we can fund. And recently, that includes the decision that we are no longer able to fund US NGOs. These types of limitations are extremely painful. CIF is ultimately a rule taker, and the reasons for this decision we have been public about and continue to do so. But I want to say that these types of decisions have no effect on the financing that we have available or for the commitment to the programs that we signed off. And in addition, we remain absolutely committed to working closely with US NGO partners. We will continue to collaborate, coordinate, and convene together. We see them as valuable and vital parts of the ecosystem. So finally, what are we going to do more of? So we will be investing more with countries directly. In the Democratic Republic of Congo, Nigeria, Uganda, and Senegal, we are already moving to direct or semi-direct partnerships. This is not instead of our work to support civil society, but it is about deepening our investment in health system strengthening. And we'll do more in regions that have the furthest to go. The Francophone West Africa, Central Africa will be an increasing focus of our investment portfolio. We'll also do things that we haven't spent a lot of time doing before. These include working with parliamentary groups, religious and traditional partnerships, to expand the type of civil society partnerships we have. We'll have a deeper focus on masculinity and masculinity norms, and working on men's SRHR as well. And we're excited about the potential of femtech and the responsibilities we have to diversify philanthropic funding. But ultimately, this is all about stronger platforms at far greater scale. You will have heard us a few months ago announcing a major new partnership we have with the Global Fund. We want to do the same for family planning and safe abortion care. It is time for us to end funding gaps for things like commodity financing. And we need to back national level impact. So I'll close there. Sorry if I've gone on, but I want to just say we are highly motivated by partnership. I was in Kisangani in Eastern DRC in August at the invitation of the national and regional government. And there we joined Norway, the government of the UK, priceless NGO and technical partners, and the state and national government coming together to back a coordinated scale-up plan. Collectively, we'll be investing over $100 million, of which CIF will contribute 40 million of such, in a deeply coordinated, partnership-driven approach. And the last thing, final, is to say, we do not always get it right. We are very prone to mistakes and to overconfidence and arrogance. So we want to learn from you. We want to hear feedback on what the foundation could and should be doing better. Thank you.
Thanks, Miles. I'm sure some of your questions are already being asked. Maybe just to follow on to that. So for example, Miles, if one wants to provide feedback, what's the best channel?
Well, we're here.
Okay.
And we're available. And so one of the best things is to come and speak to us directly. Okay. We have corporate policies on responding to feedback, so anything that comes through to us does not get ignored. And we are an organization that, at least aspirationally, we want to have a culture of learning. So I'm on the executive team. I represent the organizational culture of CIF, and I can tell you we have an active interest continuously in better understanding what our partners think of us, and what those of you who we don't fund think of us too.
Great. Yeah, thanks, Miles. So let's move on to the GFF. And so, Supriya, the GFF occupies a unique position at the intersection of philanthropy and government financing. How can philanthropic capital be better leveraged to crowd in domestic and private sector financing for family planning and broader MNCH goals? And you probably can just tell us a little bit, maybe 30 seconds, about GFF as you delve into it.
Yeah, thanks so much. And thank you so much for hosting this session and for inviting the GFF. We're really very pleased to be here. And thank you for asking for a briefer on the GFF. I still don't know who in the room will know us or not, but basically the Global Financing Facility was launched in 2015 alongside the SDGs as a way to support the highest burden countries in the world, close the financing gap to be able to meet the SDGs. The GFF is essentially a country-led partnership that is housed at the World Bank, which becomes an important factoid given the rest of my comments. But we are really committed to reducing preventable maternal and child morbidity and mortality, but we're also equally committed to advancing the health and rights of women, children, and adolescents in the countries where we work. Right now, we have partnered with 36 countries and that may well increase over the next few years. So, getting back to your question, I really like the way you framed it, that we sit at the intersection of philanthropy and government-led financing, because on the one hand, yes, we are a multi-donor trust fund, we are a global health financier, but because we are housed at the World Bank, we are actually wholly committed to making sure that our financing goes to governments, goes to government budgets, and goes to supporting government health systems. And for us, that's really at the core of making sure that we support governments on their journey to have sustainable financing for RMNCH and nutrition, and that governments, especially now, are able to become more resilient. And if I should think that most people in this room share our definition of resilience, that one definition would be to see that governments are able to have less reliance and dependence on external financing. And so we really see sort of crowding in resources around government priorities and even on budget, on government budgets, to be one pathway to help our countries get to that state of being resilient. So, in terms of the how do we crowd in financing? We have a few different ways. So one is we are a global multi-donor trust fund, and we we're at the generosity of our bilateral partners and foundations such as SIF and the Gates Foundation, and our investors rely on us to use that financing to channel to countries through World Bank projects to make sure that countries' own priorities around RMNCHN are met and advanced. So the second way we crowd in financing is that at country level, we ourselves are a pooling mechanism. And so not only do we obviously pool with the World Bank, but if there are other partners who would like to pool their funds to support the World Bank project, which inevitably, finances the country's own reform agenda, then we are able to pull those partners in to be on budget. And the more and more we do this, we are pulling in partners that have historically been off budget. So if this is a turning point, if 2025 is to be the game-changing year, where more and more countries take more and more control of their budgets, their reform agenda, and really lead partners who are off or on budget, then this is one way to do it. And finally, the third is there will be partners who either cannot or do not wish to pool with the World Bank, but what they bring is really essential TA that sits off budget, but can certainly be much more aligned with the government's own priorities. So I think we play very much this alignment function in countries, whereby we work with a number of partners to come around the government's stated priorities, the government's agenda, so that even that off-budget TA will go a long way to help the government use their resources in the best way possible. Thank you.
Thanks so much, Supriya. And I think one of, and the engagement usually is at the national level. And can you throw a bit of light on what happens with subnational governments that want to connect in a program like this through the national level?
So that's a great question. So at the national level, we have been supporting the government in a number of different ways. We support the government's stewardship and leadership of a country coordination platform that should be very inclusive of CSOs, foundations, bilateral donors, academic institutions, private sector, et cetera. We support the government in terms of strengthening data systems and data use. And we also then now are making a big push to sort of get down to subnational level, especially in terms of data visibility. And that really goes to strengthening our focus on equity. So we use subnational data to really look at what emerging priorities are, what the disease burden is, and to make sure that financing, whether it be government or off-budget financing, is actually going equitably to the regions of countries that are worst off. So we are hoping that, for example, I work very closely on Pakistan. It's one of my focal countries, and there we are, because it's a devolved system, we're actually helping the provincial governments to set up these provincial coordination bodies and to really support provincial leadership of these processes.
Right.
So, but really, we're really leaning into data systems to help us do that, to get stronger at subnational level.
Okay, to get a better understanding. Great, thank you. Shall we now move to the Inter-American Development Bank, IADB, Emma? The IADB brings a regional perspective on how development finance institutions and philanthropy can work together. How do you see the role of philanthropic partners in supporting national and regional reproductive health strategies in Latin America?
Thank you. Delighted to be here. And I'd like to start by, please think about a young woman from the indigenous community called Cunayala in Panama that used to travel by water, by the sea, to look for sexual and reproductive health services. And the Inter-American Development Bank, based on these questions I'm gonna share with you now, has been changing. We have been changing our way of thinking and doing about how to support countries in health issues, not only for sexual and reproductive health. When a young woman like this is coming, there are 4 questions that she's asking herself. The first one is, will I get to the hospital or to the health center? Will I be able to get there? The second one is, if I get there, will I be treated quickly and well? The third question is, will they fix the problem I have? And the fourth question is, what I'm gonna do if I am charged some costs. And when we think about these questions, they actually reflect the measures, the metric of the performance of a system. Yeah? It means use and coverage, if she gets there, quality of care, better health, or if the service, if her problem has been resolved, and efficiency when we talk about money and co-payment and etc. So the Inter-American Development Bank has been evolving in that, and now we are looking at how to support countries with this systemic view, meaning that it's not only the vertical or programmatic or clinical interventions that are important if we don't support countries to look at all the elements and the factors that need to be solved and looked at and have solutions, in innovative solutions, component of our work in terms of listening to the voice of the users and the people, in terms not only of satisfaction, but in terms of trust and confidence in the system, because that gives that legitimacy. I'm sorry, but you understand. Bear with my English. From the citizens. So for us, we had during the last 12 years have experiences on especially shifting our programs to results-based financing so that outcome level results and impact level results are tied to specific and very concrete, ambitious but achievable targets. Also, we have a focus, are more focusing on equity and inclusion, and on regional perspectives, also including very strong partnerships with countries as co-financiers and executors of everything that we do and we support. with philanthropy and with private sector as well. So we have this experience on Salud Mesoamérica during the last 12 years with the Gates Foundation, the Carlos Slim Foundation from Mexico, 2 governments from Canada and Spain, and the 8 countries in Latin America, in Mesoamerica actually. And these countries contributed 50% of the cost of the interventions. So the results by financing model worked in a way that not only the philanthropy and the foundations provided funding, but also countries. And this funding was additional. So that around $132 million leveraged $44 million from domestic funding. And that was additional. And that is important in terms of sustainability and in terms of sharing risks, responsibilities, and achievements. So for us, the main issues of working together with philanthropy is that the first issue, and you were referring to that, Miles, is building a strong case and having a clear ask. What is it that we are asking? What is it what we need? When I say need, we, I'm meaning all the stakeholders. And sometimes it seems obvious, but it's not. If we don't have very explicitly written, agreeing what are the changes we want to see in our partnership, in the governance of that structure of the mechanisms, and especially how are our governors, is that the board of the bank. It's also important when building this strong case to include the issues on the high economic return or working on sexual and reproductive health and family planning in adolescents especially, and also how family planning is linked to climate change and resilient health systems, and as well linking this work in family planning with the reduction in maternal and neonatal deaths. We have found that when we support countries to build those cases around these 3 issues, it's more difficult that ministers of finance and other partners are not going to be part of this or are not going to say yes. So there are four main issues that we have seen during the last years as the value of this partnership with philanthropy and other partners. The first one is the complementarity of different sources of funding, especially from philanthropy. The funding has been used for innovative and high-risk interventions or for piloting interventions, while the development financing from our bank has been used to scale up to, for example, to support piloting of promissory interventions, but because they will be scaled up with development financing. Or if those pilots are not producing the results we want or we were expecting, there is a huge learning in that as well.
Great.
And the other 2 main issues is that we could leverage resources more easily and also using not only those not only partnering with global philanthropy entities, but with local philanthropies as well. And I think this is really important because local philanthropists, national philanthropists, and private sector enterprises are eager to work on these issues, especially because women can get into the labor market, but they don't usually know how to do it.
Exactly.
And so by promoting not only alliances with global philanthropists, but with local philanthropists, we can set very local targets as well, and learnings and exchanges and testing, learning, adapting, and scaling up innovations at the country level or at the regional level.
Great, thank you so much, Emma. And I mean, one thing that resonated with me was the results-based financing, and then the fact that they are much smaller private philanthropists in their countries that will like to know how to connect. And so you really do hit that point. Aparajita, I know that somewhere along the line you will need to run away because you have another engagement. And so I'd like to ask you one more question before you slide away. As donors move towards large pooled or collaborative mechanisms like you have with SIF and others, how can we ensure flexibility, agility, and accountability to local partners that they are not lost in the process? And I know that you're a major champion in challenging, for example, local governments to step up, for example, in commodity procurement, etc. So what is the role of partners like that in this grand scheme of things when there are larger pools of funding going on? And if you can speak a little bit to how you view that space and accountability really from the ground up.
Yeah, thanks, Kojo. I think, at the Gates Foundation, most of our investments do go to NGOs, whether they are local, whether they are movements, whether they are coalitions, whether they are implementers, whether they are advocates. So the ecosystem within which we operate is, I would say, primarily outside governments, right? That might shift over time, but as of today, if you look at our portfolio, that's where it is. It includes companies, of course, because we do a lot of work on R&D upstream. But if you think of our delivery work, including in family planning, the work is through NGOs. So the question for us is scale, because I think where we are right now is in a bit of a it's not an inflection point because every point seems to be an inflection point, but it does feel like the shrinking of resources puts more I would say responsibility on all of us to try to see how we can deduplicate, how we can work together, how we can say, oh, okay, this is being covered by SIF, so we'll do something else, or the other way around, this is something better financed by a DFI or a bank or a multilateral development bank, and our risk capital, which is very, it relatively in size compared to development finance, is much smaller because it's grant money. So that's, on the supply, I would say on the source of money side, we have to deduplicate so that then whatever dollars are left to be invested cleanly can be put into the most productive use. And so the question I would love to have some feedback from the room at some point, which is, how does one think about scale in an environment where some work is, all the work is local, and yet the sort of, when there's too much fragmentation, you often see overlaps. So you see people who haven't, so I think the question is, how do we think about the NGO community as an incredible resource to actually shape donor investments around scale? So what creative avenues to achieving scale can happen through coalitions or partnerships or alliances among partners and NGOs on the ground. And I know many of our country offices, when I was in the India country office myself, we kind of, you hand make this, who's in the room and who can work with someone else. I think that's going to be a very important piece as the money gets tighter and tighter and as governments get more and more focused on trying to prioritize investments. And FP should be at the top, we all know, but it often isn't. And so how can we mobilize advocates, but also implementers who just show by doing that this is an important issue, and that the best advocates I've often mentioned for family planning are just the users themselves, the women who benefit from it, the men who benefit from it, the actual advocates. So mobilizing that on the ground community requires help from the community itself. So we are absolutely listening, and so and I think the question is, how do we receive your input so that the donor funding can be put to its best use, given how much under pressure donor financing is at this time?
Thanks so much, Aparajita. And again, Aparajita re-echoes what Mouse said out there. They're looking for ideas and looking for feedback to figure out, to be straightforward to a question so we can get a lot out of it. So shall we have the lady sitting there? Can someone help with the mic? We have mics, yeah, okay. Okay, so just quickly, just Vanessa to that side, to the left, this way. If you just mention name, which organization, and quickly state your question, and we'll take 2 questions, and please tell us who you're directing your question to.
Thank you so much. I'm Jackie Katana from Faith for Family Health Initiative. I'm civil society leader with the GFF, both at country and global level. And I would like to go straight to Aparajita, sorry if I don't get your name right, from BMGF. Because I've been in this space and GFF has helped us to coordinate CSOs, I have some experience to share. One is that most of us, the partners, donors, especially philanthropists, we are being accused of causing fragmentation. So like in GFF countries, we already have the RAMCA plus NCSO platform. But another donor comes and forms a coalition for our project. I don't want to mention, but I even know what BMGF is supporting in different countries. Then you get to know I'm a leader actually both at government and local level and global level, but I even don't know who are CSO supported by CIF. So in a way, we need to be able to align our financing. For example, if there is a platform for civil society that is strong, let's align and support that and make sure that we deliver. Then the other one is...
sorry, no, hang on. I'll just take one question,
okay,
please.
Thank you.
There was another hand here, Vanessa, and we'll just take that and get the answers, and then we move again. Sorry.
I have a mic too, no?
Sorry? Okay, was somebody with a mic already?
Yes, I do. Hi.
Go on.
I'm Diana Hernandez from Girls First Fund. We support community-based organization in the Dominican Republic. Just one question, let me see. I feel that sometimes philanthropic and community realities don't align in what is a priority and what is needed. And that's a challenge that we face at community level. From your perspective, what will philanthropic looks like if trust, not paperwork, was the starting point?
And anyone in particular you want to direct your question to, or to the entire panel?
No, all of them.
All right. So let's start. Aparajita, do you want to take that question?
I think that's a really good call out. I think much of the fragmentation is donor driven, and we are responsible for creating that. And I think what I guess I was trying to get at is now we are in a different space where, you know, I'm talking to our partners almost more than I'm talking to my own team at this point, because, you know, we are not in the place where we can allow that kind of fragmentation. The system has lost its bearing a little bit, and we have to help make sure that every penny can not utilize, but in a way build on assets that exist. It does require sometimes making trade-offs that aren't comfortable for either side, but I do think it is upon us to take some responsibility as donors to really work with partners to see where we can build on existing and where we must do something that isn't part of the main already available platform. I think the bar is higher for us now as donors, but thank you for asking.
Thanks, Aparajita.
Kojo, I'd like to add something to this.
Sure, go on, Emma.
I think for too long, only countries or other organizations have been accountable for the money or the financing or the resources that they received. But we are not accountable. Yeah, I mean, we haven't been accountable, or we need also to be accountable. It's a mutual accountability, and we need to find out some mechanisms or schemes to make sure that not only the ones who are executing or are responsible for achieving results are accountable, but also the ones who are supporting the organizations and the systems to achieve results. And I think this is like a pending issue.
Right. No, thanks, Emma. And thanks, Aparajita, and we appreciate that. And to the second question, will anyone else, do you want to throw some light on that in terms of, she talked about trust as well.
We found that community-based models are expensive. I would like to know
Sorry, somebody asking a
Factor you
question.
evaluated, what would the
Okay, so there is some feedback from the back. If the sound team can look at that for us.
method or
Thank you.
you
Miles.
using that method?
So I think it
then,
would be
Mike talked
uncontroversial for me to
about
say that
the fact that
not many people would describe SIF as a trust-based philanthropy, and I'm just dealing with our reality here. However, we do increasingly support pooling of funds, and we are moving more towards organizational funding rather than project-specific funding. And that is about a build-up of confidence and knowledge about how our respective organizations work. Each organization has its own culture and priorities, and we have to have mutual respect for each other's differences there. And I would say it's not easy, but there are great examples that we have of where we have moved to much more flexible funding with organizations that would not naturally be traditional partners of a foundation like SIF. So it is a work in progress. It's something that we recognize. I can also share that the average size of a SIF grant has grown exponentially. So the data backs up that we are moving away from we need you to do this particular lever to how can we actually invest in a way that supports an organizational mandate or a pooled funding mandate. The only other thing I'd like to just share, because it's absolutely a fair criticism to talk about fragmentation. I think it's also, we do co-create with other funders and partners, but I'm actually very pleased with the work we've done to avoid recreating the wheel, to coin a phrase. So under the WISH program, which involves dozens of partners, led and designed by the UK, one of the most important platforms for reproductive health in a number of countries, we are now a major co-funder of that exercise, and we did not co-create that. We came in to think about how can we add value to what already exists, what has been aligned with country strategies, and take advantage of the creation exercise that has been designed by others, and we'll do more of that. Thank you.
No, thanks, Miles. I'll take two more questions, and let me look a bit to the right here. So let's go with this lady here. Please, your name, where you're from, and straight to the point.
Yes, so this is for Miles. I'm Dr. Joya. I'm an OBGYN, and I run a nonprofit called the National Birth Equity Collaborative in the United States. And I appreciate your moral clarity around not funding the United States at this point, because I'm an NGO in the United States. And when family planning is used under different administrations, it means different things. So I work with the federal government, the UN, and sometimes it means abortion and sometimes it doesn't. So I think the lack of moral clarity, even around the term, feeds into how we all receive funding, and it gets us to the situation we're in right now where it could mean the rhythm method. So how do we have moral clarity the way that you did around cutting off US NGOs to hold governments accountable for what family planning means?
Thanks for that question. I knew, Miles, that will come. I mean, they will drill down a little bit more. So be ready, Miles, to be able to answer. Gatsamba, do you want to, can we put the mic here, please? Is there a mic there already? Yeah. Okay.
Can you hear me? Oh,
yep.
There we go.
Go on.
Good afternoon. Thank you. Thank you so much for this panel and for making yourselves available as funders. I think it's a really important conversation. My name is Cassandra McIsh-Gross. I'm the Business Development Director for the Johns Hopkins Center for Communication Programs. On the discussion around fragmentation, I wanted to share something that I learned actually at an earlier session here, that the opposite of fragmentation is solidarity. And I can't take credit for that, but what I wanted to share is that I think in this current environment where the funding landscape is changing, there's a certain inevitability to multiple funders, multiple implementers, and multiple governments. And that's not necessarily a bad thing, that there's going to be these multiple systems operating at once. But I wanted to make a plea that the way to move from that fragmentation to solidarity is really an investment in knowledge management. That coordination that we're talking about to build solidarity is knowledge management. And I want to ask that funders sincerely consider investing in the kinds of platforms that bring together those various funders, those implementers together so they can be sharing what's working, scaling up and communicating and kind of bringing together those agendas together. Thank you.
Great. No, thank you for that contribution. So with that, I'll take a third question, and then we will go to some answers. And I promise I'll come to the back. So we'll just go to a next round with the back, and then we'll be wrapping up. Go on, Gazanfar.
Thank you. Thank you, Kojo. This is Gazanfar Abbas. I am Chief of Party for the Challenge Initiative, which is being implemented by Green Star Social Marketing in Pakistan. I have a question to Supriya. GF has pioneered blended financing, but how do you make sure that your financing does not substitute government's own spending, and the money that government had to spend still comes across within, your funding, in the presence of your funding? Second thing is that within governments, we know...
is that a second question, Gazanfar?
No, this is part of the question. How do you make sure...
All right.
How do you make sure that there are always wastages and imperfections within the government system? So how do you deal with that? Because third world countries are third world countries for a reason. And one reason is that there are imperfection in the government system and wastages. So.
Okay, so I think Supriya is finding it a bit difficult to get. The question is that, the first one is that, how do you get governments to step up in terms of their contribution when you are providing this financing to them? So we'll start with Miles' response, and then to Supriya.
Thanks for the question. I think if I understand it correctly, I should have been clearer. Our decision, unfortunately, that we are unable to fund US NGOs is not specific to SRHR, family planning, or reproductive health. It affects our entire portfolio. So, and indeed, the organizations affected are disproportionately outside of the SRHR space. So it isn't specific to it's totally issue actually agnostic. It's much more about what we've shared in the public domain. And as I mentioned, CIF is a rule taker, and in all jurisdictions that we operate in, we operate within the parameters of what we're permitted to do. So I hope that helps, but if it doesn't, I'm here and happy to have the continuing conversation.
Thanks, Miles. Supriya.
Yeah, thanks so much for the question from TCI. Basically, your question on how do we get governments to do more, our model, we really look to using incentives in the most optimized ways. So just to start with, we give grant financing, and we often pool with other grant financiers. And if that goes into a World Bank project, it effectively incentivizes governments who may not want to borrow for primary healthcare to borrow for primary healthcare, because most of our countries are underspending on primary healthcare. So that's one piece. The second is we have different incentives mechanisms that we're able to deploy depending on the country. The World Bank is using more and more output-based financing instruments called programs for results, where we don't do the bean counting of input-based financing, but we look at broadly results that really map to the reforms they want to undertake, and we disperse on the achievement of these results. So that gets governments to do more. The other piece is we're right now, we're in collaboration with both CIF and the Gates Foundation on looking at how to incentivize increased domestic resources for contraceptive commodities. Because I think that is one place where the loss of USAID this year has been most acutely felt. And I think governments do have the capacity to spend more on their own contraceptives for their own citizenry. And we can, through our mechanisms, we can put in a certain amount of money and through a World Bank project and require that in return, over time, the government will put more money in year on year on budget on the recurrent side for commodities. We hope to do that for other MNCH commodities as well. But these are just a couple of examples. The GFF, alongside our financing to governments, we also give a hefty complement of high quality TA. And the TA really goes to optimize that grant financing we give, the IDA that the bank gives, and to make sure that the content of what's in the project is what should be there, and the quality that's being delivered with that financing is there. Thanks.
Thanks, Supriya. I'm sorry, but it appears that we've run out of time. We'll be wrapping up in another 5 minutes. I could take one question if you would do it in 30 seconds and really high speed. I have to choose one person. Whoever the mic gets to a bit from the back. And it has to be towards the back, please. A mic towards the back.
Thank you. That was a joint effort from this table. Hi, Lauren Bellahouse from International Medical Corps. We are a humanitarian organization, and this is an area where throughout the week we've been hearing more and more about the importance of government investment and buy-in. I completely agree for SRHR. There are also many places where us as humanitarian organizations, if we're upholding humanitarian principles, we're not working directly with governments. They often are party to conflict, and where we see the highest rates of maternal and newborn mortality, lowest rates of family planning, humanitarian context. So I would just like to know how you see humanitarian actors, local and international NGOs, fitting in with this new sort of reset and focus on investment in governments and scale.
Great. Who would like to take it? Okay, Mouse and then Supriya. Do you want to go first, Supriya?
So thanks for that question. Just to say, one area we see that's become really critical is to figure out how to reduce the duplication between humanitarian investments and basic human needs in these fragile conflict, violence-affected settings where just about 40% of our countries are. What we're finding is there's a lot of inefficiency in that space as well, and we really want to make sure we're working with our humanitarian constituencies, humanitarian partners in country, and humanitarian donors to make sure that they're also in this conversation about reprioritizing declining funds. So that's a great point. We also feel that there's a lot of overlap, particularly in the nutrition space, but certainly also in the SRHR space. And often it's our humanitarian partners that are delivering those critical services to women and girls. So we're very keen to work even more with our humanitarian partners. Thank you.
Right. No, thanks, Supriya. Mouse, do you want to add to that?
Yeah, in general, CIF is not a funder of humanitarian programming, but that is changing given the multiple crises that we see and the huge needs that are increasingly concentrated in conflict-affected and humanitarian settings. So, I mean, we are taking an active look at how can our investment strategy support that. For example, in northwest Nigeria, we are now a funding partner of humanitarian programming led by Médecins Sans Frontières for nutrition interventions and increasingly integrated programming, so integrating SRHR. And we feel like there is a particular value add for philanthropy to maintain that, the importance of integrated strategies and to back up more integration of SRHR within humanitarian partners.
Great.
So it is something that we are, totally conscious of. And overall, we don't, recognize the point is incredibly well taken, and it's such a difficult question to answer. Given that we are non-operational and we don't operate in humanitarian settings overall, it is an area that CIF is relatively new to.
Great. No, thanks, Miles. So to wrap this up, I'm just going to ask the panelists just to give us 30 seconds of a statement that you'd like to leave with the audience, right, in terms of this topic of the new era of philanthropy and government or development financing. And I'd like to start with you, Emma. What would be your parting words? 30 seconds.
The commitment that we all need to be more flexible, adaptable, and trying without fear new models, especially of financing linked to results. That's what I would say.
Thank you so much, Emma. Miles, do you want to give us your parting words?
Philanthropy is under even more attention now for good reasons. There is enormous opportunity for philanthropy to do more, and we believe there is a desire there as well. They want to invest further. I think there is also a massive question of how to ensure that precious resources are deployed in the most efficient way. And efficiency isn't just about outcome-based cost-effectiveness measures. It's actually how do we strengthen the overall ecosystem. So I would just end by saying I think it's been really great to get participation from the audience. I think you've got incredible insights into how philanthropy can work better. And as I said in my statement, we're here to learn. So yeah, keen to continue to get your input.
Thanks, Miles. Supriya, your final word.
Yeah, just to say, in my 30 years of working in public health, this really is quite extraordinary times. And instead of leaving here with a negative message, I want to say it is also an opportunity. And we have a tremendous opportunity here to reset, and countries have an opportunity to redesign their systems, to fit within the diminishing resources they have, and to really take on their stewardship role. And it's incumbent upon us as philanthropists to really, for us to work more closely together and to lead from behind and support government leadership, and to create more resilience amongst these countries. But I do see it as a real opportunity.
Great. No, thank you all so much. And as we close, 3 messages stand out from our discussion today. 1, philanthropy is evolving. And as you heard, they're willing to hear from you. So funding projects to empowering systems and communities is what we're looking at in terms of the evolution. Number 2, equity and local leadership are not just guiding principles, they are prerequisites for sustainability. And the third one, which I think came up pretty strongly, is that collaboration is the new currency. So across foundations, governments, private sector, and communities to ensure that no woman or girl is left behind. This next era of philanthropy will be defined not by how much is given, but by how power and trust are shared. On behalf of the International Conference on Family Planning, I want to thank our distinguished panelists for their candor and insights, and also saying that you're open for discussions. And we thank you all for your commitment to this course. And to you as participants to thank for the questions, and let's keep the conversation going. So together, let's keep reimagining philanthropy, not just as a source of funds, but as a force for lasting, locally owned transformation. Thank you all, and we look forward to talking further on in the conference. Yeah.